Hello and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. As a side note, if you want to work with me directly, you definitely can. I'm one of the only physicians in the world that is obesity medicine board certified and a certified life coach. So if you want to work with me directly, you definitely can. I'll leave that info at the end. Okay, so office hours, we are talking about your excellent questions. I always appreciate your questions. And if you have questions afterwards, leave them in the comments or on a particular video. And I would love to hear about them. If your question leans a little personal, I am going to change it a little so it's more broadly educationally applicable. And I can't answer personal medical questions because I'm not your personal doctor. Okay. With that said, okay. Is dizziness with Saxenda something to worry about? So dizziness with Saxenda is actually not uncommon. It's probably one of the side effects I hear about more often with Saxenda than with other medications. Let me know if you have been on a couple of these and you have found the same thing. But I definitely hear about it a little bit more with Saxenda. Anytime patients have dizziness who are on a GLP-1, there's also other things that I am thinking about. So, are they dehydrated? Because a lot of times people on these medications are, especially in the beginning, they're not eating and drinking properly or enough. So that's another great reason to make sure that you definitely have a follow-up plan with your physician, that you're being appropriately monitored on these medications. So it's really important to make sure that you, anybody on these medications is, getting enough intake in terms of food and water. And also important to think about other medications that they may be on that might be contributing to this dizziness. So, for example, what can sometimes happen is if you're on one of these medications and you're on a blood pressure medication and you're losing weight, your blood pressure medication may then be too high for the medication, for the weight that you're now at. So let's say you were initially on, when you started Tirzepatide, your blood pressure was around 120/70. Then you lost some weight. Now your blood pressure is like 100/60. You can definitely go down on that, or you're in theory, you could go down on that. But it's just something to be aware of, that of course, your medication needs are going to change over time in terms of the other medications that you're on. And one of the beautiful things about these medications is sometimes if you go on these medications, you can go off other medications. So, and blood pressure medication is no exception to that. It's not going to be working like that for everybody. Not everybody will be able to stop their blood pressure medication, but some people can and probably should if it's getting too low on as they're losing weight. So for anybody who's having dizziness on one of these medications, you definitely want to check in with your physician, but it's definitely not, a totally uncommon presentation for somebody who's on this medication, and Saxenda in particular. Great question. Thank you so much for sharing. Okay, next question. You didn't mention the horrific price and disgusting side effects that go with these meds I see. Of course, the ketogenic or carnivore diet works forever and it doesn't cost anything. That is what a real doctor would recommend. Okay. I definitely do talk about side effects all the time, actually. So there's a whole playlist of side effects for anybody who's interested, and I'm always adding to it. So if you want to know about side effects of these medications, definitely go check that out. I am a real doctor, and I definitely would not recommend the ketogenic or carnivore diet for simple reasons that, diets that people follow need to be sustainable. And what I've seen is that the ketogenic and carnivore type diets that are very like meat heavy are generally tend to not be very sustainable for people. And that's really, what the literature shows is by far the most important thing in terms of how people are changing their eating is to find a plan that is sustainable for them. So in general, those don't tend to be very sustainable for people. People don't generally like to stick with them. That said, if you are somebody who really enjoys it and you find that it is something you would stick with, the other reason I don't recommend it is because it definitely can increase your LDL cholesterol, which is your bad cholesterol, and that is the cholesterol that's most linked to your risk of heart attack and stroke. And I don't think anybody wants to increase that risk. So I don't recommend it. You know, in America, you can eat whatever you want, it's totally up to you. So people can make that choice for sure. It's not one I'm going to recommend. I usually steer patients more towards plant-based flexitarian, Mediterranean, somewhere along those lines, but you can definitely eat whatever you want. But those are the reasons why I wouldn't recommend those particular eating plans. Next question. Okay, this is I'm going to change this one. It's a little personal. This is really about joint pain on a higher dose of tirzepatide versus a lower dose. And as we've definitely discussed before, joint pain is not something that I see a lot, but several of you have noticed it when you're starting on these medications. And like I've said before, a lot of times joint pain gets better. A lot of times inflammatory pain gets better on these medications. And also when you are losing weight, you are relieving some mechanical stress on your joints. So for both of those reasons, a lot of times joint pain improves, but there are always the people who are going to be outliers. And certainly as people go up on medications, they may find that side effects they had in the past might become more severe. Sometimes they go away, but sometimes they get more intense. So if someone had maybe a little joint pain on a lower dose, they may find on the next dose it gets more intense, and that might go away or it may not. You won't really know. Time will tell. But thank you for sharing. And it's definitely, like we've discussed, it's not outside the realm of possibility. And if you are somebody out there who's having joint pain, let me know. I would love to hear about it because it's not something that I've seen a lot close up in person, but some of you definitely have experienced that. So thank you so much for sharing. All right, next question. Okay, this one is also a little bit personal. So I'm going to change this. This question is about Rybelsus and how to take it. So in general, does one have to take Rybelsus on an empty stomach, or can it be taken with food? And this is a question about the lower dose of Rybelsus. So Rybelsus goes from 3 milligram to 14 milligrams. And side note, Rybelsus is FDA approved for diabetes, but not for weight. So right now, I definitely wouldn't recommend that anybody think about that medication for weight. It's not approved and also hasn't been really shown to be effective at these low doses. So but usually, yes, Rybelsus is generally taken first thing in the morning, about 30 minutes before any food, beverages, medications. You can take it with a small amount of water, but that's kind of it. So, and that's to help with absorption. So in general, if we're thinking about if you can't take a medication appropriately, the way it's going to be best absorbed, in general, that's a good time to think about maybe another medication. And, Rybelsus is kind of notorious for being hard to tolerate. So it's not unusual that people can't tolerate it. So if I had a patient who was on Rybelsus and they were having a hard time taking it appropriately, the way it's going to give them the best benefit, if I was prescribing it, it would be for diabetes, and there's lots of other options for diabetes. So I would think seriously about switching them to a different option, because there's no point in taking something if it's not going to be absorbed. That's going to do it for today. Thank you so much for watching. If you want to work with me directly, I do work with people one-on-one as a life coach. So if you're interested in that, I help people with the one big thing that's coming between them and their weight loss goals. It's a lot of mindset work. So if you're interested in that, you can definitely book a call down below. We'll chat. But anyway, that's going to do it for today. Thank you so much for watching, and please be well.